Depends on the car, the model of the car. Not all cars you can use. And they have they're working on the design for car transfers, and especially most of the people are using auto rickshaws. So to go into that, the spreader bar probably need to be longer, and the base, how you adjust that, I do not know. So they have it. So these are areas of research which needs to be done. I think other points cross slide. Okay, does anybody want to try? Do you want to be a volunteer? Do you want to try using it? It's a hands-on workshop. Yeah, sure. A lot of time allotted for hands-on. Any questions you can have that you can ask? Ramp, yes, it is possible. There is definitely, it is possible. With the ramp, it will go down the ramp. There is the person who is controlling this needs to be, yeah. So going from down up is no issue, but coming from up down, the person who is controlling it, or maybe two people can control. That is possible. Yes, we have not used it. I use the lift whenever the lift is available. I use the lift. So, yeah, if there is a lift, I prefer the lift because somebody has to control. But then the handles are high here, so you can have a fairly good control. We just pushed it up that very steep ramp again at the back side of Ginger Hotel. So it's not easy. If it's a very slow ramp, it is easier. But if it's a steep ramp, it's difficult. It's heavy. It's possible. It is possible. Then you'll have to give that idea to them. Maybe the wheels can be modified. Like if you want to take it across a ramp, then maybe you need better wheels or better casters. Yeah, you tell them what kind of, so what function you need, you have to tell that specifically, then we can customize it. Yeah. Yeah. The stability. You can use the mic.
Yeah. If we increase the wheel size, the basic problem that we are facing is medical bed and all, there is a crossbar.
Crossbar.
So there are chances that it may hit the crossbar.
The crossbar. It won't go under the bed.
Yeah.
So that I'm having a lot of problem because I use height adjustable beds. So the height adjustable beds, I use electric ones right now. So there are batteries at the bottom side, and then to place the hoist under the bed becomes difficult. So I've got to see which type of bed. We have like changed 3 beds to use because we bought the hoist first and then the beds. So so you have to look at all these things. So when one person, remember, we gave the hoist. You want to try? You can. Yeah. What do you want to do? Do you want to lift or you want to be the patient? Okay. Who wants to be the patient? Okay. Yeah, Mike, please. Yeah. So one of the patients we gave, he had a bed that he was a paraplegic having a lot of problems. At the time he was not trained, did not go into rehab acute phase. We gave a hoist because he already had wheelchairs given by many people, and the bed was donated to him from the hospital where his wife was working. And it just had a crossbar. So we told them to, they went in, assessed, I went in personally, assessed. So my solution was you lift the bed, you put 4 bricks at the 4 legs, lift the bed up by this much, like 1 brick under each leg, and then you can use the hoist. So we donated this through the district collector's fund. They did not lift the bed. It was made according to their house measurements, the door width, everything was taken. And it stayed there for 1.5 years. Okay, and this device it was not used. So I had told, luckily for us, we had told that when we give a device free of cost, that we will take it back if we are not using it. So then we took it back after 1.5 years, gave it to somebody else with a brain injury, and they used it. Ultimately, he could have the potential to go into rehab. He is now able to have good aesthetic balance, good control. He is now using a wheelchair, but this did happen because we gave that onus. And if we had done that, probably if we lifted that, we brought 4 bricks and we placed it under the bed, maybe they would have used it. So I didn't bother to do it. I thought, okay, it's such a simple thing that we'll be able to do. But just that bar was difficult. Okay, anybody else wants to try can have a try. These are only people who are working formally in a rehab setting might require, or a caregiver. So I prescribe to many people, but ultimately how many buy will be less than maybe 10% or even lesser. Yeah.
She has a doubt.
Yeah, sure.
The person who is very sad,
Yeah. So yeah, that is one of the problems. There is no problem. You have to lift in between the legs. You have to lift the sari up. Yeah.
There are 2 times.
So you can. So you may also lift like this, or you can put cross. So for the first time when we did, it was under the legs. Can you just cross and show? You may just see how with the sari you can do. So this is coming in between the legs. Okay. So if you are wearing a sari, what you can do is you cross this onto this side under the leg. So it is okay. You take it under the sari. So your dignity is maintained kind of. And you do this. Okay. Or maybe you can be the next volunteer. If you would like to volunteer. Yeah, sure. Yeah. So she will volunteer next time. Okay. Good question.
Okay, for boys it's not
It's not at all. Yes. Yes.
But coming to
Yes.
persons who is wearing dhoti, the same problem.
Yeah, munda, dhoti and all, they'll have the same problem. Insane. Practically, we face issues like, once we start doing it, there are problems that you'll have to go around. Does anybody want to lie on the table? Do you think? Shiva? Yeah. I was asking if there was a better way to go with it. It was difficult to get right. Yeah, from the table, somebody can do. You can do from lifting from the table. Yeah, can you transfer onto the table, right? Mike, if you're okay, we will transfer you onto a table. Okay. Any question you want to say? He is asking a lot of questions and we are not coming to know. So for the lifting, there is technically not too much. Only the placement of the sling. That the remote will do and the machine will do. It's just this part. Sometimes you may just have to guide the sling. Yes, you have to take them, so you can, you may have to all the time explain to the person what you are doing. So now you are being lifted, we will go to that table and you will be placed on the table, okay? And you have to lie down on the table, okay? Or you can sit on the table, whatever. Let him do. So you have to be careful, this is going to hit this table, right? Okay, and this is enough because you are going to put him on the table. Okay, so you need to lift him up a bit more. Can you lift him up a bit more? Yeah.
You can be on the other side, so
You can see, yeah, if you are transferring, it's better that you can come this side and see where you are going to put him. Okay, he needs to go up again. He has to sit here, right? So, Mike, you're okay? Do you feel scared? I think Mike was the wrong volunteer. Should be someone who will be scared, probably. It will still touch the table, or maybe can you lift a bit more? Yeah, I think that will be good. So if there is somebody to guide, it is also good. Okay, now what you have to do, you bring it as close. Yeah, you bring it as close to the surface, your destination surface as possible. Don't lower him right now. Okay, so you place him. Yeah. No, no, we'll see. Now, slowly, you can come here and lift and guide your, you can hold this remote. You can guide, bring him down. Okay. You may even ask him to say when your buttocks are touching the table. Okay. And, you want to sit or you want to lie down? You want to lie down. So you may have to guide him further. So you have to make it back. Your transfer device. So you have to again now lift it up. Lift him up now. Again. So that is something that you have to decide before you transfer. Whether you are going to make him lie down or you are going to make him... Yeah, that is good enough. Then you unlock the device. Yeah. You push him as far as possible. No, for that you just have to... Yeah. So, yeah, that may be enough. Almost. Then you lock the wheelchair. If you want his legs to go up on the table, then you may have to lift higher. But this is good enough. So you lock it again and then now you lower. Now you may have to guide his head also. Hand. Yeah. Yeah. Yeah, there may be a handle may be provided in this way. Slowly. Now they have head control, it's fine. You can tell them to, sometimes I tell them to bring their hands outside and they can hold on to the bed or they can go on to the railing. Okay. And go down. You may have to go further down. It's okay. Yeah. So usually bed transfers we do from the side. So this we are doing from one edge.
Unfortunately, he has fallen from a place. Like, is there any safety, so we sit there? Is there safety?
So wherever you stop, you could take the hand off the remote. Can you put your head? No, this sling is still holding him. He is not yet in the sitting position. Can you lower it a bit more? Lower it as much as you can, and then you remove the sling. You have to bring it a little more down before. Yeah. So I've guided the head so that it's not hitting, and then you remove. So now this hook is very loose. You can remove it quickly. But this is not so loose. So maybe if you feel it lowers a bit more, it will be easy to remove this. Then you lift up the device before you move it back. You lift up a little bit so that you don't. See, then you position the person carefully onto the bed. Okay. And can you lift this up? Not yet. His legs are bent. So you know. So before you remove the device, can you lift this up? Because it might hurt him. If he, lift it up a little bit more. Yeah. And then you take the device back. And how you remove the swing is if the person does not have leg, you can tell him to turn to one side. Can you turn to this side, Mike? Can you turn to this side, to your left? So then you can roll this under him. And can you roll to the other side? It will be slightly uncomfortable. Can you roll to the other side? Then you can easily remove the sling. Okay, that's fine. Great. Thank you, Mike. You went great. Thank you. Good. Very good. So doing it for the first time, it's, they need to learn it. So when I teach bystanders, when the team teaches them, there's always a fear. But once you get to know the safety features of the hoist, then if it fails, then it's not good. Okay. Do you want to try? I think you should know. She wants to. You can sit on a chair. Anyone wants to volunteer? You're afraid? Anybody? Yeah. Do you want to try? No. Do you want to take the? Do you, any of the girls? Do you want to try? Come. Abhishek is coming. Does anybody else? Any ladies would volunteer? No. Come. Yeah. Abhishek next time. Sorry. And I'm very well, so I can bully him. Sharon? She is volunteering. Okay. Put the sling across her. Okay. So you can explain to her. So they are just putting it for you. You have to come forward a bit. You have to tell her what to do also, okay? No, tell her also what you are doing, okay? Because she will explain. Okay, now. So she's hearing it, right? You have to tell her, okay?
So we are putting the
Maximum low, going maximum low. Okay. Now they are going to bring the device under her leg. Okay. No, she's supposed to be paralyzed. She is not moving. So you don't move at all. So you should imagine as
See, she's very sleepy child.
sleeping child. She won't speak, she won't move. Okay, so you may tell her that I'm going to push you a little forward. That you can push her a little forward and yes, exactly. So this is how, these are the difficult part. If they cannot move, then you will have to guide. And it's intended for a person who cannot move, okay? Okay, you can go back, yeah. You should give a running commentary. It's like we're giving a running commentary when you're doing this. You have to lift her legs and put them across. So you have to tell, I am lifting your leg and putting this under it. No, you're not heavy. Yeah, here, Sharon. Here, Sharon. Yeah. This one here and the other one across. Yeah. She's slightly towards the edge of the chair, so you've got to make sure that she doesn't fall from here. Yeah. Yeah, that's it. Yeah, that's it. Yeah. And this one. Yeah, that's good. Okay. Now you have to bring it forward. Okay, I'll hold it for you. You don't have to hold it, it'll fall down, nothing will happen. Okay, so you have to now bring it forward. Okay. So lift it again. Okay, so Sharon says the position of the bar has to be at the level of the forehead. Can you bring it closer? Can you do this way? Yeah, that's it. So you secure both the sides symmetrical. So you put it on the first one, so this has to be the first one. Now can you put the other one? This one also. So the third level, because she's sitting comfortably, right? So if you put here, her head will come down, right? So you put it on the first, second, third one. Okay. Now just explain to her we are going to lift. We'll lift now. Can you just come here and explain to her? Whatever she tells you, let us know. Okay? Okay, now you can Yeah. Maybe that is better. Yeah, up, down, yeah. Yeah, you should keep pressing. So if you leave, it will not move at all. Okay, only if you keep pressed, it will go up. Are you okay? Okay, you may see her expression. Yeah. I think somebody should take a video of her expression. Yeah. Okay. How do you feel? Do you feel scared? Do you feel unstable?
She feels like
Hanging. Hanging, yeah. So that is the feeling of hanging that they'll have, like hanging in the air. Is it safe? Like, does she feel safe? Does she feel as if she's going to fall? No. So in this, we didn't lift your legs, we didn't lift your sari, and this can be going under this. Yeah. 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 Okay, Sharat says this is a small sized sling. For you, we should have had a bigger sling, so that you'll be like a cocoon, it will become like a cocoon. So it'll be much closer. We may have additional, so this part is, kind of constricting. Is there any pain here? Yeah, she does feel there's a pain. The smaller size of the sling. Okay, so if we use a bigger sling, she wouldn't have this discomfort. You may place her down. We'll keep you down. No, that's okay. No, she wants to move forward. Okay, so sorry. Yeah, please. And see if you can lift. I forgot your name. Reena. Okay, can you move her with the hoist? With her. So we'll go. I'm just going to hold her for support. Yeah, is it difficult? So controlling is a bit. Or you can turn and put her in that chair, maybe. Slow, maybe slow. Okay. Good. You can go to that chair and you can place her down. So both of them are using for the first time, and it's no big deal. It's a very simple device. You may have to bring a little bit back. Correct way of checking. Yeah, I think.
You can come this side, so you can.
Exactly. That's it. And she's going to lower it now. You can lock the device. Yeah, that is very important. Otherwise, it may move. You can go that side, and you can guide the sling. Okay. And lower. Yeah. You may just pull the sling a bit back so that her back is touching. So before that, we could have just pulled it a bit more. Back, can we just go up a little bit? A little bit more, yeah. So if you just pull the sling back, and she will place it exactly at the back. So correct position you will get. That's it. You have to watch the pocket. That's it. This is enough so that you can easily remove the slings. Or you can do it. Yeah. That's it. You may use it to your comfort. Now you may lift it up. Either you bring it back, either you push the device back, unlock, push the device back. That's it. Okay, so she's safe now, and you can. Good. Maybe a big round of applause. You may either get up or we can remove the sling. Okay. Most welcome. Anybody else wants to try? Yeah, Abhishek wants to try. Can somebody be a volunteer? Abhishek, what do you want to do? You want to be the patient, okay? you want to do? Anyone wants to do? You may do it. Most of them are not going to be using it in routine life. Yeah, please. Okay. One more time to. Okay. After this, probably because the transfer chair needs to be assembled, they are doing it outside. And okay, we have physiotherapist. You are paralyzed. You are acting like a paralyzed person. Okay? For Abhishek also the sling size is small actually. He needs a wider sling. I use medium wherever possible so that I can. You can just do individual, yeah. You do the straight one, yeah.
Any questions? Anybody wants? The first one is the second one. Second. Both sides. Just check the symmetry.
many persons with the spinal cord injury, they don't have sensations. So here we are taking the advantage, we are having everybody normal subjects, we are asking them, are you comfortable? But for a person with spinal cord injury, a person with cognitive affected, they may not be able to see. So we've got to check and we train them how to do it. So all this is enough. Like if the pull is too much, 20 minutes if we are taking for this transfer, they can develop a pressure also wherever the straps are hurting. Once the staff are confident, then they only use this. It's an easy way out. It's just the time taken to put that sling, place the sling, and that's it. After the ceiling lift was installed at an IPM, all the staff, even for bed change, they'll use the sling, they'll just lift the person a bit up, like say a bit, and then they'll fill the bed, they'll change the sheets and they'll place you back. So it's very easy, convenient. But the ceiling lift installation takes quite a bit. So each turn will be costly. So the turntables that work, that is where the cost is. And the present system we have, the Arjo system, you need around 6 meters of height onto the ceiling. So if you are planning to build a new setup, it's something that you can work on from before. So I have it going all the way to one toilet. So the sling is washable, that can go into the toilet. So this sling is not washable. And the comfort of those foreign companies are much. You can bring it inside and do assembly. No, it's 5 minutes. Okay, fine. Okay. Do you need a break? Or can we move on? So, because this is not really commonly used, I think that's one of the problems. Many people are seeing for the first time when we are showing them.
Is there any alternative which makes more convenient than this method or something? I feel still the very tedious process kind of thing. I agree that it solves the functional problems.
Yes.
Still the convenience part is very less.
Yes.
Is there any other alternative?
So the ceiling lift that you are fixing on the floor, so I mean on the ceiling. So yeah, it's only through the path you can go. It can have both X and Y axis. You have 2 axes, your cost doubles or triples, it depends. So that is very convenient because the station or the charging station stays on top. You'll have like, so the NIPM, I may have a video, let me see. You don't have things like this blocking your way, it's not so huge. And only when you apply the sling, you bring it down. There is also a mechanical part and you can do it wherever. So I have asked, so what we've done is like we have beds on both sides, so it can go from horizontal this way, from between the beds. So the person can be transferred, lift up, go this way, then come this way and go to another bed. So, but it costs. So that is much more.
How much those cost?
So this one is between 70,000 and 1 lakh, depending on the customization. I've gone up to 1.5 where I give a walking hoist. I've also attached a bar, which will be like a parallel bar, the therapist will know, so onto the legs, I also attach additional grab bars, so that person will be walking, holding on to that bar. So that's a therapy purpose also. Yeah, but the hoist system that we installed at NIPM, what I'm talking about, where I used to work before, that cost 60 lakhs. So if I would have it, that was a government institution, the government paid for it, and I needed to have one. I needed to, we needed to experience what it is. The functionality is excellent. It's worth the effort. But so this is like I can get the same thing for one, same function for 1 lakh, but of course it is cumbersome. One of my patients, a tetraplegic, 61-year-old wife was taking care of him. So at NIPMR we trained him in using it. His wife was very uncomfortable. He was uncomfortable being lifted in that way. They kind of rejected it. So at hospital, people manually transferred him. But when he was discharged, he did not have much recovery, only partial recovery. Still needed dependence transfer. So so just to ease the initial period after discharge, I said like you may use one on a rental basis. Now they are continuing to use it in rental basis at 2.5 years post discharge. So it's I've seen their home, it's very congested, there was no place to put this. So I just gave him like so that when you go home you should not feel distressed, and that was the reason they were willing to take it. We've had a lot of, like one of our difficult patients, because that wife, she is a school teacher, she is a retired school teacher, and she was asked like, can the wheelchair be incorporated into this, can you have mobility along with it, like can we take it? So they didn't want to take a transfer device at all. But there was no other way if she wanted to transfer him. So now even at 2.5 years, she is now using it just because of the comfort. They've moved to a better home, they've moved to a bigger space, they've shifted houses, but they are continuing.
Even as a renting means the company is doing renting or?
Yeah. So we have an NGO, so we work as an NGO. So from the NGO side, we are giving it on rental basis. And so to people who have they've returned it for some reason. Yeah, so I think rental is one way of making it work, or at least until the time it is familiar to people, that works. And some patients...
They reach the capacity to buy their own.
Exactly. Another, what we do, so in terms of procurement, what I do is we work at different capacities. So the government camps, through the government camps we have given a few free of cost. So as I talked, there is a family with 4 people with severe disabilities, severe physical impairment. So it is worth the cost, definitely. There are 4 of them, and they all have muscular dystrophy. So like that, we have given 2 or 3 in the district of Alappuzha. That was the first trial where we got this positive feedback. And ongoing support, they have the medical students there, they have a work like an NGO. They formed a palliative care group, and they make house visits and they ensure that these people get addicted. So that was the reason why we gave it, that there is someone to follow up and make sure that they are using it. Then the second thing we have done is in Trishul. So the district collector was interested to give high-end AT devices, because the other ones, the low-cost devices, are all given free of cost. They're distributed freely to people. So only these high-end devices, they have difficulty. So the collector formed a group, and we were instructed that patient should be able to use it. It should not go to waste. So, and the person who was not using it, so we've taken it back and we've given it to them. What I have started recently at Amala, which is a private medical college, what we do is I've started an Amala assistive devices support program, where the person has to put some money towards it, and again only those devices which cannot be procured from a government funding and costs high, truly indicated, so it will be assessed in the assistive technology clinics. We have twice a month we have 80 clinics, where if there is a person who requires a hoist, I will call them also. We have a P&O coming regularly. Every 2 weeks there will be a P&O coming, and we assess together. If they are truly interested, then they have to put some money into it. The rest of the money will be sponsored by Amula through sponsorships, and we'll help them with procurement. So we do that for all high-end prosthetic devices, all that costs. All the pneumatic, the hydraulic knees, all that we give support. So funding support, and my thinking being, if they pay some amount towards it, they will use it. If they can free of cost, many people tend to neglect it and not use it. Okay, so we are ready with the transfer chair. I think we'll wait for Sharat, is it? Sharat, then we'll come. Okay.
Sir.
Okay, so we'll now have hands on again. Anybody interested can come forward. So that's a mechanical transfer chair. So that's, can all of you see? So that's mechanical. Again, height adjustable. Okay. Ah. Okay. Yeah. Okay. So we'll see how whatever is possible. We'll see. So the prerequisite being the person should have adequate trunk control. They should be able to balance the trunk. So for that, totally dependent person, no able to control any aspect, any body, like even if they do not have neck control, we can use a hoist or a ceiling lift. But to use a mechanical chair, we need to have this. Intuitively, I was thinking, or we all would think that this is much easier to use, and we should have this more than the other one. But somehow, in regular practice, what I've seen is that they tend to use that more than this. Okay, and it may be because you need a good trunk control. Okay, can you demonstrate, Sharon? Yeah. With the chair. Okay, so this is a small device, is it? Okay, function
Functioning.
Yeah, functioning yeah.
So this is actually a height adjustable transfer chair. It is basically used for the person who is having a upper support. Like if he is able to sit on the bed on himself without any external support, definitely this device can be used. And I will be doing a demo how it is working and all. I will be doing a demo.
You can see the problem being this chair is too wide for this particular transfer chair. Yeah, but still can't you do it still?
Yeah.
Inside he can control on. We'll try. Come over, yeah. So there is height adjustability. The lock here. So there is height adjustability in this. It can go up or it can go down. This is totally mechanical, so the cost will be less. This may also be electric or hydraulic, depending. We need.
In case of hydraulic, there is a risk factor, like inside there is a fluid. So fluid leakage, there is a safety risk according to the hydraulic pump. But in this case, it's a threaded rod inside. In the electrical also, it's a threaded rod. So the safety side is better compared to the hydraulic one.
Okay. So the load capacity is 100 kg. Yes. Okay, fine. If I want more, can you make it for a person? If the person is heavier, can you make it?
Yeah.
Yeah. Okay. Okay. So this one again, you may have the spreading base. This doesn't have.
Yeah,
This does not have, but it is possible. This is a basic function, is it?
Yes.
So this is a basic function. So they have like this basic, premium, and mid-range. They can do. So that height adjustability, that spreader bar adjustability that we gave in this, we can also attach in that. Okay. So just totally mechanical. You bring it inside. You open the back widely. Okay. You keep the legs on the leg bar. You close it. Bring it closer. And then actually you do one side by side. They have to lift the buttock, that's why they have to have the good control. You just tilt to one side, lift the buttock and place this. Yeah. And we'll place this under the buttock and you're actually getting onto the seat. And then you lean to the other side. Yeah. And then that goes under the other buttock. So, has to have really fair to good trunk control. So, be able to lift the buttock off the table or the bed and then back. Again, if they don't have sensation, I will never advise a base like this because the skin can get pinched inside and comfort. So there is a safety belt in case, again locking feature in the casters, and you just push him forward, pull him forward. Yeah, cross belt is there, and then you can take them to the toilet with this, and they can transfer onto the toilet chair. If you want, you can also give a commode in this chair if you want. We can do any type of customization. And that is a handle, right? So this is a handles to push. So in this you are in the front of the person, you are not at the back like the wheelchair. So this is the back strap and this. So the only mechanism here is this, you bring both the...
There is a double lock.
There is a double lock.
For extra safety.
Oh, okay. The original devices we only had one hook, right? Yeah. And that was not working well if the person is not sitting, so now they have done the additional strap. How do you feel? Okay, it's better than on the sling. People generally, I would assume that this is better. Much smaller device, it takes a little bit less space than the other. Intuitively, I was always thinking that this would be what people would want. But when they say this costs around 30 to 35,000, the basic wheelchair, and it can go up to 75, is it? Yeah, it's a completely electric, it will go up to 75.
There is an option for here, the lower part of the sitting part is metallic. We can do it in both material itself. So it will give extra comfort for the person.
Cushioning, or you can do anything else, yeah. But somehow people don't tend to be buying it. Again, the common questions I've had is this: can they sit on this for a longer time? Like, we say use this to transfer onto a wheelchair and then sit in the wheelchair for half an hour. They say, isn't it okay to just sit in this for 30 minutes? Intuitively thinking, I would say yes, maybe like why not sit in this? But then it doesn't offer other supports, like does not have other features of the wheelchair. If all the other features were there, then probably we could give. So being just a single use only for transfer, I'm assuming that maybe there is. I have not done a detailed research on this. Probably IIT is planning to do a further research on these transfer solutions. I think we need to work on this. This is okay for bathing. You can sit in this and take a bath. Yeah, it should be okay. It is okay. So if this is used,
we prefer, since this the frame is mild steel, we prefer stainless steel material for bathing. It will be rust proof.
And then the cost goes up. That's the problem. So if bathing purpose means, all this we've had for our patient, that the previous patient I was talking about, we have had so many discussions and they keep changing. We want that function, we want this function, which we were not able to do everything in one.
And that's
so
basically it's a trial and error.
It's a trial and error. As with any other assistive technology, we'd say it's trial and error. And I do think it should be customized and whatever the person wants. Then the tendency, the problem when we customize is the cost goes up. If it is made in bulk, obviously it is better. Okay, any other points? In general, if it's a spinal cord injury unit, you're working more with paraplegics and all, this is a good option. Yeah.
I have a suggestion or feedback regarding our product that can give.
Yeah, does anybody have any suggestions or feedbacks? I will not advise. I will not advise a person to sit on this for 45 minutes or 1 hour. No way. Because it's made of steel. If they have sensory deficit, if it's a person without any sensory deficit, maybe okay, but it does not have a good back support. It does not have any features that we generally want in a wheelchair. So I will not advise. I might prescribe this and I will say it is only for the transfer purpose, not for sitting. And that is probably why people may not buy it. Yes, we can do customization, yeah. Not that, no, I have not needed any 6 months maintenance. I have not needed any maintenance in fact for this except what...
Actually, one of our customers had a service after 5 years for this product. And that too for a battery backup issue. They just need to change the battery on.
In the ward where I use it,
The only thing we need is that this push on that door, but that comes off or something like that. Not with the function I have not had. Mechanical issues I have not had, electrical complaints. Battery anyways, will need replacement after some time. And that is one of the reasons why I use their products, because I can, if at all anything is required, I can get them easily.
And feedbacks are always.
So the only problems I have faced is this, the wheel size, not going in the spreader bar, not going under the bed. So all beds it will not go under. So you have to, look, I had because I was also picky about the bed. So I needed height adjustability. I needed a good railing, which will not even come in the way. So those beds, ICU beds have this railing that goes down, right? And then person cannot transfer well. So I needed a very small railing, which would offer only adequate help to get up or something. So when we are looking at when you want more of therapies or of rehab, then you need good functionality. And so a few of my patients now what they'll use this for transfer in the ward. Then they'll go with the motorized wheelchair or whatever chair. Then the hoist somebody will bring via the left, because we only have one left. So they'll bring the hoist onto the physiotherapy unit, and then again they'll use this for transfer. Otherwise what they do is they'll say, all therapists please come to so and so room for transfer. Every person being transferred onto the tilt table, every person being transferred onto the therapy bed, they'll keep this announcement, and I thought it's not right. So all the therapists are stopping therapy for, and then going in for assisting transfers. So yeah.
If you can provide good posture,
Yeah. Yes, yes.
So that's why I'm asking. Generally, I'm
Yes.
I do things. If you customize like good cushioning for postural control and everything,
Yes.
we can teach the patient to implement these things.
Yeah, sure.
100% possible. 100% possible. Then we just have to make it customized. Concise. The person's, so this may be too huge. It may be reduced in width, in height. Yes. If there are not too many sensory issues and all, I have no problem in them going and eating. Like this can be taken. But there are a few patients who use this, go onto the dining table, sit there and eat, and then come back.
And some people have an issue like this product is too heavy. They find it very difficult for transportation. So they asked us a product which is foldable, and this need to be foldable, which can be accommodated in the back space of a car. So we are doing that also. Like we are minimizing the
Overall dimensions and size, right? Like, I feel this is too wide and it's really too heavy. But because this is, it can be dismantled, right?
Yes.
You just assemble
It can
it.
be dismantled,
Yeah.
but it's time consuming.
Time consuming. Like when we brought it here, it came in a box, right?
Yeah.
How big was the box? Can you bring the box? Let me see. Yeah, even I was not sure because they always bring it assembled. Okay. I think there needs to be more research, and if things can be made compact and easily easily assembled, like the new motion chairs and all. Okay, that is big. Okay.
Yeah.
Hello. Sir,
All right.
camera
Any
on
other question you would like to know?
Like, can you show the reverse feedback and
How you are transferred back? Same thing.
if there is some complication, like
Yes. There is no complication. Only thing when you are removing it, again you got to lift the buttock, remove that, and say, yeah, there will be a height. Yeah. Yeah. Yes. Height adjustment is on the back. Like you want to do, but cheyamo. If this chair was slightly lesser in dimension, like width was less, then it will go rightly height to put it. First height to put, no? You're going down, can you go up? Yeah. A bit more. Yeah, I think that may be good. Yeah. Okay, then can you bring it back? We have locked the device. Yeah. Okay, first look. Yeah. Okay, now you lock the device first. Then again you bring down, like you lifted this, then you bring down the device. Okay, so, and then you open this from the back. That's what it is. They have to be able to balance this. This much of trunk control they should have. If they don't have trunk control, they cannot do. No, they have to have adequate trunk control. Upper body control has to be really good. Only then you can use it. You cannot support a person without having a head control. They cannot sit in this. In the other one, no need, you are supporting the sling. But in this, you need to have this kind of a control. The maximum is that they can hold on to this and lift. Okay, but this control has to be there. Otherwise, and they have to sit back and they have to hold like this. They have to balance. That balance they have to do. We cannot use it for people who do not have control. So upper body control is must. Hemiplegics and all, maybe. But they will even otherwise learn how to balance. So another problem is that all the hemiplegics and all, they may not really require it. If they learn how to balance their trunk, they may be able to use the other limb and then shift, transfer. So the techniques of transfers can be taught. So they may not really truly require a device then. So this is only for paraplegics with a good trunk control. Only. And then the other side being the paraplegics will learn how to transfer even without a chair. Right? They may be able to transfer from chair to bed just with their arms. No, I use the same one. I just use a different jacket. Yeah, just the sling is different. It is the same thing. And even the handles or the parallel bar that I give will be attachable or detachable. So if I want, I can use it. Just the sling is different. It will be a jacket, walking jacket.
And there will be side rails for the
Side rails. And the side rails again detachable.
Even we can customize if you need a seat to stand or also it's possible with the customization of the sling.
Just the slings has to be customized. So I bought two slings, one this one and one walking jacket. So again we'll have a bar coming under in between the legs and in the chest straps and jackets and from the shoulder. Which one?
No, it's the top, maximum height possible is it's the
6 feet in this particular device. If you want higher, you have to tell that before manufacturing. Yeah. Yeah, already 6 feet means you need a higher device.
In case of weight also, 120 is the load capacity. If you need higher load capacity, it is possible, but before the customization, you should tell this.
Yeah. We don't manufacture bulk at all. They don't manufacture bulk at all. So if every patient, we have a patient or only then they manufacture it. So I am...
As ma'am already mentioned, we have an examination before manufacturing. We
go into the patient's homes and do the assessment.